Oh, Lynn, just letting you know the interpreters are here. Pat is actually going to go second, so you can pin me, Jennifer, first, and then we'll switch. We're going to be switching every like 15 minutes again. Thank you.
Good evening, and welcome to the fourth town hall on COVID-19 vaccinations for children, ages 5 to 11. This session is brought to you by the Contra Costa County Office of Education, Contra Costa Health Services, Kaiser Permanente, La Clinica, Lifelong Medical Care, and John Muir Health. Before we begin, you should know that this town hall is being live streamed on youtube.com/CoCo Schools and broadcast on EdTV, Comcast Channel 32, and ATT Uverse Channel 999. Now, our Spanish interpreter will give instruction on accessing the Spanish translation. Sandra?
Buenas noches. Esta reunión de la municipalidad tiene accesible interpretación al español. ¿Cómo se accede a la interpretación en español? Haga clic en el icono de la bolita del mundo, que es la interpretación. Después marque español y como opción puede, si desea solamente escuchar el seminario en español, pues haga clic en el botón de mudo para el audio original. De lo contrario, va a estar oyendo las dos versiones, en español y en inglés. Gracias.
Thank you, Sandra. And now we will turn things over to Contra Costa County Superintendent of Schools, Lynne Mackey. Superintendent Mackey.
Thank you, Marcus. And good evening, parents, guardians, caretakers, community members. Thank you so much for joining us for this town hall tonight. We hope to give you information about the vaccine for children ages 5 to 11 and answer questions that have been presented. And we might even have time to get to the additional questions that you might have tonight. Tonight, joining me is a panel of Dr. Chris Farentano, the health officer from Contra Costa Health Services, Nicole Brito, nurse practitioner, pediatric provider, COVID-19 case investigation and contact tracing director from Contra Costa Health Services, and Dr. Robin Mizan, medical director from Pediatrics of John Muir Health. The flow of tonight's town hall will go, nurse practitioner Brito will do a presentation, and this presentation was generated by questions that we received from the community and from just general facts about the vaccine. And so we'll have a presentation, and then questions have been submitted in prior town halls, and we put them into kind of like 5 different buckets. They all kind of fell into different categories, and the panelists will answer those questions, and then we'll get to any questions from the attendees tonight. So with that, I'm going to turn it over to Nikki, nurse practitioner Brito. take it away.
Thank you, Lynn. We're really excited that we have this opportunity to share this information and answer some questions that I know many of you had. So thank you for joining us. Next slide. I also want to say thank you to Dr. Robin Mizan for joining us on our panel today. Next slide. So we'll start out with going over COVID here in Contra Costa County, what our case rates look like, a little bit about the history of vaccines for children. We'll also go over the COVID-19 vaccine for kids, some of the clinical trial information, and then how to get COVID-19 vaccine appointments here in Contra Costa County, and then move to our question and answer session with our provider panelists. Next slide. So here in Contra Costa County, so this slide really can show you that here in Contra Costa County that our case rates are really primarily driven by kids in this age group, the 5 to 11-year-olds. You can see the longest graph on this bar is kids in this age group, and now we're able to offer them vaccination. When we look at the information from the CDC Data Tracker dashboard, and last time I checked this was last week, there were in the United States alone, there were over 5.9 million kids 0 to 17 years old who have had COVID. And over 67,000 of them were hospitalized, and 939 kids have died. And 199 of those kids were in the 5 to 11 age group. So COVID is now listed as a top 10 cause of death for kids in the United States. And here in Contra Costa County, as of Monday, the 22nd, our case rates were about 1,000. But we can really see that the kids in the 5 to 11 age group are driving those cases. And that this is something that's similar across California, including the rest of the United States as well, with many kids that are back in school, participating in sports, a lot of extracurricular activities, hanging out with friends. So really vaccinating this age group can really have an impact on reducing the number of kids getting COVID-19, reducing the chance of severe disease, and help decrease missed school days for not only themselves, but also their community and their families. We also know that if kids are vaccinated and they are exposed to someone with COVID-19, they don't need to quarantine, and that they can still attend school. So this is another good way to keep kids in school. Next slide. Now, unfortunately, COVID is not mild for all kids. A lot of kids are not going to get super sick from COVID, but that's not all kids are going to have mild cases. Like I mentioned earlier, in the United States, there were over 67,000 hospitalized kids, and about a third of those kids were in the 5 to 11 age group that required intensive care admission. There have also been 5,526 cases of COVID-linked multi-system inflammatory syndrome in children, and almost half of those cases were in the age 5 to 11 age group. Of the kids that were hospitalized, about 45% of those kids had no underlying conditions. So these are healthy kids that don't have any medical problems. So a large chunk of those kids had no underlying medical conditions. And during the Delta surge, hospitalizations in unvaccinated teens were 10 times higher than those who were vaccinated. So we know that vaccination is helping protect kids from hospitalization. We also see about 8% of kids who contract COVID, even in the mild cases, can experience, about 8% of those kids are experiencing long COVID symptoms. And these are symptoms that persist for weeks and months. Since March of 2020, there have been 153 Contra Costa kids who are under the age of 18 who have been hospitalized. And we see that these hospitalizations tend to spike during surges, particularly in the surge we saw in August. So when you're looking at this graph is showing the impact that vaccination has on hospitalizations. And this graph is looking at population 18 and up. But when we look at it, the tall spiky line is the line that is for unvaccinated. So of the people who are hospitalized, you can see the majority of them were unvaccinated. Fully vaccinated folks were in the very low bottom line. So you can see a very dramatic impact that vaccines have at protecting people from hospitalization. Next slide. So the history of vaccines for children, we vaccinate kids for a lot of things. We vaccinate kids for tetanus and diphtheria, measles, mumps, whooping cough, chicken pox, polio. And so we have a lot of tools in our tool belt to help protect kids from these infectious diseases. But there's still approximately 300 deaths each year in unvaccinated or incompletely vaccinated children from those diseases. If we look at just at COVID since January of 2020, COVID has killed 939 of our children in the US alone, which is more than all of these other diseases combined. So now we can add COVID to COVID vaccination to the list, COVID as to the list of disease preventable vaccine preventable diseases. All right, next slide. So the vaccine approval process is very lengthy, and there's a lot of steps. So the typical life cycle of a vaccine is that a group of scientists will develop and study the vaccine, and then they present their data to the FDA. And so the FDA advisory panel will meet, and it's a group of scientists and doctors and they all meet and review the data. The manufacturers will present the data from the clinical trials and will present it to this group. They'll discuss it, and they're really looking for, are these vaccines safe? Are they effective? Sometimes the FDA will say, you know what, we need more data, and they will send the vaccine manufacturers back to collect more data in their clinical trials before they would approve it. So we see that once the FDA approves the vaccine, then it moves on to the CDC advisory panel, who will then make a recommendation to the CDC. And they also review all of the data as well as the implications on our community. So once the CDC approves it, here in California, we have one further step where we have a Western States scientific review work group that will discuss the information as well, and then make their recommendations for use here in the Western states of the United States. So you can see there are many, many steps to check for safety and effectiveness. It's a very vigorous approval process. With the pediatric vaccine, COVID vaccine studies, they actually had initially presented data to the FDA, and the FDA did send Pfizer back to add more study participants to collect more data on its safety and effectiveness before they would approve it. And so this is why we see our pediatric vaccine approval coming later than the adult approval, because there was a lot longer of a process in terms of collecting more information. So next slide. So let's talk about what those clinical trials that's presented. Pfizer, they had initially had 2,268 trial participants, and then they added an additional 2,379 participants in that safety expansion group that the FDA had asked for more information on. And so therefore, there's a total of about 4,647 kids in this study. About 3,109 received the vaccine, and about 1,538 received a placebo. Now, what they found is that the most common side effects were mild to moderate, about 1 to 2 days, which was similar or actually less than what we saw in older teens. It was more likely to happen after the second dose. Most kids had a sore arm, just like adults and older teens did, and about 39% of kids had felt tired for a day or two, or maybe had a headache, or few had a muscle pain. Less common, but was still possible, or fever, chills, body aches. But like I said, they were for about 1 to 2 days. They also found that the pediatric antibody response was comparable to that of what we saw in the older age group. And this was also in the setting of the Delta variant circulating in our communities. And so we found that the pediatric vaccine was effective against the Delta variant. Something important to know is that when the studies first started out, before they went on to the safety, further investigate the safety and effectiveness, they really wanted to start out by figuring out what dose was going to work best for this age group with the least amount of side effects. So they studied the adult dose in these children, and then in a group of children, and then they studied a smaller dose. And what they found was that the smaller dose was just as effective as the larger, older teen dose, but had less side effects than the older teen adult dose. So that smaller pediatric dose works just as well. It's just our kids tolerate it a little better. So next slide. Like I mentioned, the vaccine is a smaller dose. It's about 1/3 of the adult and teen dose. And in the clinical trials, there were no serious reactions. They also looked at the immune reaction, that the general immune reaction, and then compared that to the response that they saw in older vaccinated teens, and it was just as effective, or just as responsive. And then they found that it was 90.7, so almost 91% effective at preventing COVID among children aged 5 to 11. So this is a very, very effective vaccine. Next slide. So one of the other things too is that we now have many months of real world safety experience using the same vaccine in our older teens and adults. We've had hundreds of millions of US residents, and that's just in the US alone. We're not talking worldwide. We're talking about in the US, hundreds of millions of US residents who are 16 and older have been vaccinated. And we have that safety data from that. Now we also have millions of US children aged 12 to 15 that have been vaccinated. We have that safety data from that real world experience. Here in Contra Costa County, we have 89% of county residents between 12 to 15 who are at least partially vaccinated, who have at least their first dose, which is really exciting for our county as far as helping add that layer of protection. Next slide. So one of the things that they did find in kind of the younger men, so we talk about this myocarditis and pericarditis in teens and young adults, and this is a true safety signal that came up with the Pfizer vaccine. What myocarditis is it's a rare heart inflammation, and these cases were reported in teens and young adults, that mostly males under the age of 30, and it was usually after their second dose. Now, just to put it in perspective, out of over 100 million vaccinated, there were only 877 cases. So yes, this can happen. However, it is very, very rare. This side effect was not found in the vaccine study, in the clinical trial in the 5 to 11 age group, but it's really because it's such a rare side effect. This may be why we didn't see it, but it is something we'll keep an eye on. The myocarditis cases in the 12 to 29-year-olds were all mild and self-resolving. They had no long-term effects. And of these very rare cases, most older age groups, so above 16, very few in the 12 to 15-year-old age group. And there is a thought that the risk of myocarditis after vaccination may be even lower in the 5 to 11 age group, because they're really thinking that this may be tied to puberty and irritation of the heart, but it's so rare. We did not see it in the clinical trials for the 5 to 11 group. Next slide. So heart problems in COVID-19. I'll give you a broader picture of what this is. So vaccine-induced myocarditis is different than a classic or infection-related myocarditis. Myocarditis that someone would or potentially get from an actual COVID infection is much more severe and has a much higher mortality rate. We see about 20 to 30% of those hospitalized with COVID infection will develop heart problems. Vaccine-induced myocarditis is much milder, and kids recover fully in less than a month. So it's a much different type of inflammation of the heart, and it's much milder. We want to put this in a little bit of perspective. For every 1 million boys or young men who are vaccinated between 12 and 29, we may expect to see about 40 cases of myocarditis, but they're mild, and their symptoms will resolve, go away in days or weeks. But for those 1 million vaccinated, we will have prevented 11,000 COVID cases, 560 hospitalizations, prevented 138 ICU admissions, and 6 deaths due to COVID in just the first 4 months after vaccination. So pretty significant. Getting myocarditis from a COVID infection is much more severe and much more dangerous than the very, very rare chance of getting a vaccine-induced myocarditis. Next slide. So why should we vaccinate? The vaccines are safe and effective. The Pfizer vaccine, the COVID vaccines have been the most vigorously tested in all of US history. The vaccination also will keep our kids in school. Fully vaccinated students don't need to quarantine if they're exposed to someone with COVID-19, as long as they remain symptom-free. This also means parents don't need to take off time from work. Vaccines limit the spread of COVID-19. Kids, yes, we know kids tend to get less sick than adults, but they can still get COVID and still spread the virus to others who are more vulnerable in our communities and our families. So the more people who are vaccinated, the less COVID that's spreading in our communities. Next slide. So where can I find a vaccine? Well, our website, www.coronavirus.cchealth.org/get-vaccinated. On our website, we have information and scheduling links to all of our community partners. So that could be you may recognize your primary care provider on there, links for Kaiser and John Muir, pharmacies, community vaccine sites, our county clinics, We are also doing some school-based pop-up vaccine clinics, and this is public health in partnership with other healthcare providers, such as La Clinica or Lifelong, John Muir, and Kaiser. So your child's school will do outreach to families if they are hosting a vaccine site. The schools that will be hosting these school-based vaccine clinics, we have prioritized schools in communities that have been hit hardest by COVID. So you'll see those pop-up clinics in those areas first. Next slide. I'm going to thank you, and I will turn it over to Lynne Mackey to we can go over some Q&A sessions.
So much, Nikki. I'm actually going to start with just a couple follow-up questions for you, and then I'm going to jump to the panel members. One is these vaccines seem to have, there's a perception that they came out pretty quickly, right? COVID's only been around for a couple of years. We already have a vaccine for them. Should we be concerned about that? Is that, is that what actually happened?
Yeah, so this is a really good question. And last year, this time last year, the vaccine manufacturers were just submitting their data, getting approval. We were about to start getting access to this. And I will say that I did share some of those concerns when I was first really learning about this and learning about what was going on. And what I found was that the mRNA technology, which is what the Pfizer vaccine is a mRNA vaccine. This technology has actually been around for decades. It's been studied for decades. It's been used in other aspects, so in cancer treatments or different types of other. They've been working on a lot of different applications. One of the things they was struggling in years past was how to package the mRNA. They knew it could work, but how to make it so that it would last in our cells long enough to initiate an immune response, because it was just kind of disintegrating and not, it wasn't lasting long enough for our bodies to be able to start using this instruction set. And so with the COVID vaccine development, they were able to find that putting a little special, what's called a lipid ball around the mRNA, it helped the body absorb it better and just long enough so that our immune system can really learn how to build protection from the COVID virus itself before it our bodies broke it down and broke it down as waste. So now our bodies can start using this. So this research has been studied for a long time. And now when you have a pandemic, you have a bunch of scientists all around the world, a bunch of money from a bunch of places getting thrown at it. And they were able to find a solution to this. And it seemed like a much faster way, even though it had been studied for a long time. The other thing was that I think I answered my question.
Thank you. The other question that came in quite a bit in the last town halls is if my student is, let's say 11, almost 12. So let's say they're going to turn 12 in a month. Should I vaccinate now or should I wait and get the different dose for a 12-year-old?
So I'm in this boat. I have an 11-year-old. I also have a 7-year-old. So I'm not only a pediatric provider, but I'm also a mom and of kids in this age group. So this is something we pondered too. But looking at the data, the recommendation really is not to wait. Get the dose that's appropriate for your child the day that however old they are, on the day that they go in for their appointment is the appropriate dose for them. We know that it's effective. Like I mentioned before, whether they get a pediatric dose or when they turn 12, they get an adult dose, that they're both effective. If their birthday falls in between their 2 doses, they could get their pediatric dose when they're 11 and then come and get their second dose, their 12-year-old dose when they're 12, and it will be just as effective as well. So not to wait. I'm not waiting. I definitely took my kids in. They're about to get their second dose on Wednesday. They're all excited. I think they are hoping to get a sticker when they get their thing and do selfie station too. So
thank you, Nikki. I'm going to jump to Dr. Mazan now, and I have some questions for you. First one, because some of the questions that came in wanted to know, like personally, did we get our children vaccinated? And I always say my grandson got I'm a grandmother. He got vaccinated as soon as he could. He's 6 years old, did really well with it. Very excited to do it. So that's what I'll start with you, Dr. Mazan, is do you have children? Did you get them vaccinated? Would you recommend to your patients, your families, to get vaccinated?
Absolutely. I have 2 kids and they're fully vaccinated. They're in the 12 to 15 group. And it was a great highlight of our summer. And as a pediatrician, I recommend it for my patients and their families. And I see a lot of enthusiasm. And as Nikki was talking about, just this sense of relief too, when you get your kids vaccinated, that the sort of the world opens up for them even more.
How should parents prepare their children for the vaccines, like for actually coming in for their appointment?
I think first, see if they have any questions, concerns. As much as you can, let them know what the day is going to look like for them, where you're going to go, what you're going to do, stickers, ice cream, whatever you're going to do afterwards to celebrate. What we don't want you to do is don't pre-medicate with any Tylenol or Motrin before the visit. It can potentially reduce the effectiveness of the vaccine. It's better to wait till after, but of course, after sore arm, totally fine to give an appropriate dose of medicine. You want to follow the instructions when you go in. They'll have them be seated for the vaccine and often wait 15 minutes at every vaccine site. So hang out there for 15 minutes and then go ahead and go get your sticker or your treat.
Thank you. And there was a number of questions about the heart thing. So a lot of questions about that. And could this possibly give my child a heart defect? And just could you talk a little bit more about that?
I appreciate Nikki's description. I think her information was absolutely spot on. So there's as she mentioned, a very, very small risk of myocarditis from the vaccine, which actually pales in comparison to the potential myocarditis risk from getting COVID. The vaccine-induced myocarditis, which again is rare, is self-limited in children, get better quickly from it. And then we do worry about potentially from COVID, some other stress on the heart and even up to the MIS-C, and she mentioned that as well. But of course, the vaccine cannot change the structure of the heart or cause any permanent anything. It doesn't do anything about that.
Have you been seen as a practitioner, outside of the studies, and have you been seeing any other side effects that weren't mentioned?
No, and I honestly, I'm usually just a sore arm, maybe feeling a little bit of fatigue, much more mild symptoms, if any, really. Most kids are, at their sporting events, at school, doing their full day after their first dose. As Nikki mentioned, the second dose for this age group, we're just coming onto those, but what we expect is even, very minimal side effects. In that 12 to 15 group, we didn't see very much. Once again, sore arm, little fatigue, that's it.
How would you, if you have a patient and they're hesitant, what would you say to them?
I first want to see why, like if they have a specific concern, can I address that? I will say that most of my patients are actually really enthusiastic and excited to get vaccinated. I've had a few patients who've maybe been a little bit in the wait and see category, but as we look at these numbers, I mean, we have almost 500,000 first dose in this age group already in the state. Our numbers are large. Our studies were initially very robust, and as we get more and more data, I think it's all, of course, it's very reassuring and enthusiastic. So I had a patient just last week in further well visit, hadn't yet scheduled. Some of it actually is just making sure they can get an appointment and, you know, trying to make it a convenient time for their family. But for them, it was a little bit of wait and see. And I let them know that I also felt that it was a great idea. And I do think if there's any families out there that are still thinking about it, call your pediatrician. We're really available to answer these questions, and we want to be talking to you or your family practitioner about your concerns and addressing them.
Thank you. I'm going to jump over to Dr. Farentano, our health officer. So some people in the community distrust this vaccine. We got a number of questions and comments in the chat about that distrust, and they really wanted to know where they could go find studies and reports directly so that they can see the information for themselves.
Yeah, there's a lot of places people can go to get really good, reliable information. One place to start is right at the CDC's website. You go to their website, you Google COVID-19 science update. They have a page there where they summarize the latest and greatest studies. They will tell you the conclusions of the studies. They'll have links to the actual papers. They update this site like every week or two with new studies. They've got good graphs and diagrams really explain the studies. So that's really a great starting point. You can also go right to some of the most respected medical journals like the New England Journal of Medicine, the Journal of the American Medical Association. The Lancet is a British journal that's very well respected. It publishes a lot of studies about COVID. You can also go to leading medical institutions like San Francisco, University of California at San Francisco, Johns Hopkins, the Mayo Clinic, all of those medical institutions, have a lot of information about COVID, about the vaccine, about the virus. So there's a lot of places where you can really go to the experts. And then again, go to your local experts, the folks you trust. Go to your local pediatrician, your local family doctor, your local internist, and ask those questions of them as well.
Thank you, Dr. Farentano. Why doesn't this, many of us have seen friends get the vaccine and still get COVID. Is this different from other vaccines? Why are people still getting COVID even after they've been vaccinated? And why should they still get vaccinated if there's a chance that they could still get COVID? Yeah,
no vaccine is really 100% effective. Even the measles vaccine, which is one of our best vaccines, very, very effective. The reason we're not seeing people in this country who've been vaccinated against measles get measles is because we've really wiped out measles. But when we do occasionally get an introduction from a country that still has measles, and it will spread usually mostly among people who are unvaccinated, but occasionally someone who's been vaccinated will get measles. We saw that with the Disneyland outbreak a few years ago. Usually when they do get measles and have been vaccinated, the case is much milder, and that's exactly what we see with COVID. We do see some people get COVID after a vaccination. The COVID vaccines are not 100% effective, but fortunately, it's usually much milder. It's much more effective at preventing severe disease and death than just preventing mild infection. So the vaccines are a big benefit, even if you do get one of those breakthrough infections.
Well, what if I've already had COVID or my child has already had COVID? What about natural immunity? And do I still have to, or should I still get vaccinated if I've already had COVID or my child's already had COVID?
We strongly recommend, and I strongly recommend people get vaccinated even if they've had COVID. We know people can get COVID a second time. The second time around, it can be much more severe. We know also the immunity that you get from a natural infection is highly variable. It can be strong, it can be weak, and it changes from person to person. There was a very recent study in Lancet Microbe, which is a sister journal of Lancet, that concluded that people who had COVID infection once, they can expect to get reinfected within 1 to 2 years on average. And the vaccine gives an antibody level that is about 17 times higher than the antibody levels that we typically measure after a natural infection. When people get boosted with a booster dose, that antibody level is actually 34 times higher than a symptomatic natural infection. And asymptomatic natural infections, the antibody levels tend to be even lower. So the vaccine gives you a much more predictable and much stronger protection. We know that people who have had a natural infection who take the vaccine, that vaccine's going to reduce your risk of a reinfection by at least 50%. So if you've had a natural infection, it's still a really good idea to get vaccinated.
Thank you. I want to talk a little bit about consent. There was a number of questions about consenting for children going to school. And I just want to say thank you so much for all of the clinics that have been going on and all of the school pop-up clinics and school clinics. It's been really helpful to schools. But I've had parents ask if they send their child to school, is there any chance, and they don't want their child vaccinated, is there a chance that their child will get vaccinated anyways? Or do you have to have either written consent or, the parent there?
Yeah, there's really no chance that anyone in any of our vaccine clinics is going to vaccinate a child without their parents' consent. Our standard process is we require a written consent whenever possible. Occasionally, we may have a child show up without a parent or without the parent filling out that written consent and sending it along with the child. And then we try to get a hold of the parent by phone to get that verbal consent. But if we can't reach the parent, the child does not get vaccinated. We don't want to, vaccinate children without their parents' consent.
So I know that one of our 18 school districts, one has opted to make this vaccine mandatory for their students. As of that will take effect early January. What about the rest, the state mandate? When will it roll out for the other districts where this will be mandatory? And do you support a mandate for vaccines?
I do support a mandate for vaccines. We have seen vaccine mandates for school kids to be highly effective. And what it does is it really raises the overall level of vaccination, and it helps protect those children and we've seen that with protection from measles, from whooping cough, from all those other childhood diseases. So mandates are really important in creating a safe environment for kids to go into school. As far as the state school mandate is concerned, it's expected to go into place next summer for the fall semester. There is a personal belief exemption that currently is in place for that. That will remain in place unless the legislature takes action in order to remove that personal belief exemption. So at this point, as things stand, if parents don't want to vaccinate their child, they can sign a personal belief exemption and their children can still go to school. The other option always for parents who don't want to vaccinate their children is a homeschool option.
Yeah, I do get calls, and back when Tdap, back when the last vaccine that kind of rolled out, I was a school site administrator, and I got calls about people that really, they were not going to get their child vaccinated and what could they do. In the state, the California Department of Education, if you go on, they have a whole homeschooling section, a department that they can walk you through how to become a homeschooling option for your child. if that is going to be your option. So other than you covered the opt-out category, another question that is I get asked all the time, regardless of vaccine, is when will children be able to stop wearing masks? Is there like a rate of vaccination where we'll be able to stop wearing masks? Has that been determined yet?
It has not been determined yet. The state, through the California Department of Public Health, currently is setting the mask requirements in schools. And I know I've talked with some of those state officials, and they're not prepared at this point to set any precise thresholds or criteria for when those mask requirements will be lifted. I think they really want to get through the holidays and see if we're going to have a holiday-related surge, and really kind of see where we are, at the start of next semester after the holidays. Are we having a winter surge? Are we doing really well because we vaccinated so many school children? Before making any decisions about when those masks and that extra layer of protection can come off.
Could you tell us a little bit about the Omicron, if I'm saying that right, variant, and what you think this means for kids and for the vaccine effectiveness for it?
Yeah, this is the latest variant. It was first identified in Southern Africa, and it really was just reported over the last week. And so we're really learning much about this day by day. It's already been detected in many parts of the world, in Europe, in Asia, in a case in Canada. It's likely already arrived in the US, just hasn't been detected yet. What's concerning about this variant is it's got several dozen mutations, and some of those mutations seem to make it spread more easily, be more contagious, and it seems to be spreading very quickly in Southern Africa. What we don't know about this variant is, will the vaccines work just as well, or will there be some reduced effectiveness of this vaccine? We also don't know, is this variant gonna produce more severe disease or milder disease, and what its effect will be on kids. We saw with Delta that Delta was more contagious in kids and tended to produce more severe disease in kids than previous variants. We don't know how this variant will behave. Fortunately, all the other variants, the vaccines have been holding up really, really well. And so hopefully that will be the case with this new variant, but it's very early days and only time will tell. So the best strategy right now is to use our best protection, which is the vaccination.
Thank you. Now it looks like we have some good questions in the chat, so I'm going to jump to those and see if we can get them all answered. And we can just, whoever has the answer can jump in and answer. So let me start with, if vaccinated people who get breakthrough infections have reduced symptoms, but carry just as much as a viral load per the CDC, do they become super spreaders? Do you have an answer to that?
I can address that one. There was one study that looked at an outbreak in Cape Cod that suggested that viral levels in post-vaccination cases were very similar to unvaccinated people. But that study really looked at a single point in time, 2 or 3 days after symptom onset. There's been a bunch of other studies really looking at the whole time course of when someone gets infected, and most of those studies show that if you're vaccinated and you are unlucky enough to still get COVID, the viral levels drop really, really rapidly, because your body has that memory response where it's really, once it detects the virus again, it remembers seeing those proteins that were in the vaccine, and it makes a very vigorous, quick response. So those virus levels drop very low. And also a lot of those virus particles in the nose are kind of coated with antibodies, so they may not be as contagious, even if we're measuring just virus levels in the nose. So for a lot of reasons, we think that you're much less contagious if you've had a vaccine and then get COVID compared to an unvaccinated person. who had COVID.
Thank you. Someone asked, I read in the news report about 14 children between the ages of 5 and 11 years old that accidentally received a double dose of the vaccine. Are these vaccines pre-diluted or are they diluted on site at the clinic? And maybe you can also comment on what happened, what was the effect of those kind of extra strength vaccines?
Take that one.
Okay, Nikki, thanks.
So the pediatric doses, like I said, are 1/3 of the adult dose. In those kids that had received a double dose of the pediatric dose, they were getting 2/3 of an adult dose. If you remember a little bit earlier, I talked about that they had tested the adult dose in this age group as part of the clinical trials. They found that it was just as effective. It just caused a little bit higher likelihood of experiencing some side effects, but that it was still safe and effective. So those 14 children, we feel, can rest assured that that pediatric dose, doubling the pediatric dose was not going to cause them any harm. Now I think I'm forgetting the second part of your question.
Are they pre-measured out or did they?
Oh, right. So the Pfizer vaccine arrives, it's a little orange vial, and it is diluted on site by the nurse. The nurses are trained to dilute it properly and draw up the accurate dose. And so that's how it arrives and how it's drawn up on site.
Thank you. Okay, how can you be sure there are no negative long-term effects with these vaccines if they haven't been tested over the long term?
I can answer that one. It's partly the basis of what we know about vaccines and how vaccines work. We know vaccines, you're introducing, it's either an entire virus or a kill, in the case of the measles, it's a weakened live virus. In the case of the flu, it's a killed virus. In the case of COVID vaccines, they're little proteins, just proteins or from the virus. So, and those are all broken down by the body within days or weeks after getting a vaccination. The side effects we see are your immune system's reaction to those, particles in your system, but those particles go away and within days or weeks, which is why we see the side effects occur within days or weeks of getting the vaccine. We don't see new side effects cropping up, 6 months, a year, 5 years, 10 years after somebody gets vaccinated, because the vaccine's out of your system long before that. And we now, we see that with the adults that, folks in the clinical trials started in the summer of 2020 getting vaccinations. Some of those folks, it's now been almost 18 months since they've gotten their vaccination, and we're not seeing new side effects show up outside of that initial 1 to 2 month period after the vaccination.
Thank you. And then there's another question about the actual study. How many kids were hospitalized or died from COVID in vaccinated group versus placebo group in Pfizer's medical trial? Does anybody have that information?
The study girl does. Yeah, there were no deaths in either the placebo or the vaccinated group during the study. There were no serious adverse events either, and in particular, there was no anaphylaxis or myocarditis like we talked about. But a lot of these things are super rare, right? And because they're super rare, we're likely not going to see them in the initial clinical trials. We may see it, like the myocarditis popping up after millions of doses have been given because it is so rare. But there were no deaths in the clinical trials.
Thank you. I want to give everybody just a chance if you have any final thoughts or information, or if there's anything that you wish I would have asked that you would like to convey to the caretakers and community that we are talking to tonight, and then we will wrap it up. Nikki.
In my pediatric clinics, I have been seeing a lot of families, mixed reactions. Some are very eager to get the vaccine, some are very hesitant. I think one thing that I really, after, we're discussing their concerns and finding out what's going on, I think at the end of the day, I really want my patients and our community to know that I wouldn't personally recommend a vaccine that I wouldn't do for my own kids, that I wouldn't do for my own family. When this vaccine came out, I was ringing bells. I was sending the link to get appointments to all of my friends and all of my kids' friends. And so I think that's, I know a lot of my pediatric colleagues, we all share that sentiment of we really are, our patients are our family, and we wouldn't be recommending something that we weren't wholeheartedly behind.
Thank you. Anyone else?
Yeah, and just to second what Nikki said, I mean, this is really our way forward. This is our way forward for our families, for our community. This is how we protect our children, but also protect our community. So as we look into the end of this year and starting, 2022, I hope that, if any of our words have resonated with you tonight, but reach out to your pediatrician, nurse practitioner, family practice doc with your questions, and be patient with scheduling. I know I have families who are still trying to get those appointments scheduled. Now's the time. It might be an appointment for a few weeks from now, but that's okay. Just get on the books, and we're here for you. Thanks so much.
Thank you so much. And thank you. I want to thank all three of you. I do feel like this is the way forward for schools also, to try to get schools to a place where there's not stops and where kids aren't having to be quarantined, and that we can get it back to where we are focusing on the child and not the COVID. So this to me is such an exciting time and a way forward. And I really want to thank you for doing all of these town halls. This is our fourth town hall. I appreciate all of your time, and I really do appreciate the really good work that you all have been doing in our community. With that, Dr. Farentano, would you like to take us out?
Yes, thanks. I want to thank Nurse Practitioner Brito for a very thorough presentation today. I want to thank Superintendent Mackey and the Office of Ed and all the local school leaders. You've all been tremendous partners through this pandemic. It's been really hard for school-age kids. It's been really hard for parents, but I'm really hopeful that we are really taking a big step forward with the approval of the vaccine and really getting closer to getting life back to normal for kids. Almost 1 out of every 3 5 to 11-year-olds in our county has already gotten their first COVID vaccine dose, which is amazing in just the first 3 weeks. That means when the kids go back to school this week, a third of their classmates are already protected, and that's already a big step in preventing spread in this age group. I want to thank Dr. Mizan, our other panelists. John Muir's been a tremendous partner throughout this pandemic. He's really stepped up with testing and vaccinations. And just a reminder, you can schedule your child's vaccine appointments at our county vaccine clinics online at cchealth.org. You can also go to retail pharmacies or your own healthcare provider. And your local school may be hosting a vaccine clinic as well. And if they are, your school will let you know through the usual means they communicate with parents. And one final thing, parents, remember, go get your booster shot when you're bringing your child in for your shot. Most parents are getting to the point where they're probably due for a booster shot. So that's another way to protect your family, is getting your booster shot. So thank you, everyone.
Thank you, everyone. Thank you, parents, caregivers, community members, for tuning in tonight. And I hope this provided you with some information. Always feel free to reach out to your pediatrician. Also, the county health website has some great information on that website. So thank you and good night, everyone.
Good night.
Thank you, everyone. Thanks, Miss Pat.
Thank you, Pat.
It's been nice working with you.
Thanks for driving, Michelle.
Thank you, Jennifer. Thank you, Sandra.
Have a great night, everyone. And everyone out there, stay safe.
Yeah, thank you, everybody.